I'd like to welcome Dr. Javier Perez on the podcast of MedEdge, President of Federation of Intensive and Critical Care.
Yes.
Let's begin with what World Federation of Intensive and Critical Care is, and we'll pivot on to how you make things work or how do you operate.
Perfect. Well, thank you so much for the opportunity, and thank you for the invitation to be here in Abu Dhabi. The World Federation of Intensive and Critical Care is a federation. It's a society of societies of critical care. So we have over 90 different societies worldwide that they are part of our network. The idea is, as a mission, we have that of implementing and developing intensive care medicine, critical care medicine throughout the world, and trying to elevate the standards of critical care medicine. So we collaborate with different societies, such as the Society of Critical Care Medicine present in this event here in Abu Dhabi. So that's part of what we do. It's a group that really conglomerates all kinds of the specialty related to critical care. We have anesthesiologists, we have surgeons, we have intensivists themselves together. And this is a very important federation which is growing, and we have more societies getting part of this federation right now. Yeah.
So basically, if I understand it right, it's a society of societies.
Correct.
You have different specialized individuals.
Correct. So we don't represent members, we represent societies, which is important because our work is collaboration with the local societies or with societies like the Society of Critical Care Medicine. And that's why we are in an event like this. Yeah.
Okay. So how do you help in the evolution of this particular field of medicine?
So the societies such as the SCCM, or let's say the Emirates Critical Care Society, will have different products, different elements that they need to, let's say, put it in perspective to other societies. We also know what other societies in the area need. And then we try to put together those two people, right? Let's put it that way, so they can benefit from each other. And we facilitate the connection and the transmission of knowledge from one to another. So we're a little bit of a moderator, if you want to call it that way. But at the same time, we have projects to enhance critical care. And we can use that. As an example, I will tell you, Emirates, Abu Dhabi, and also Dubai are pivotal right now in the development of healthcare in the region of the Middle East. We have very, very much protagonism in multiple initiatives. We as World Federation also like to facilitate those initiatives and bring them to countries that they might not be aware necessarily of these initiatives, and try to get together with the Emirates societies. And examples of that, I believe, that are present during this meeting is the Organization for Transplants, in which transplant is a major necessity in many countries in the Middle East and also in Africa. And the Emirates Society, as an example, is an example of a major participation. And then also clinics such as Cleveland Clinic, the sponsor of this event, is also a leader in the region, and would like to use our networking and our platform in a way to collaborate with Cleveland Clinic, helping education for critical care and elevating the standards for critical care.
Okay, that's great. Since you mentioned about organ donation and transplantation, how important is it in the field of critical care?
Well, it is important. So they are both related very closely. Typically, patients who pass and who will be organ donors will be part of the critical care, or will have an intervention of an intensivist, a critical care physician. While at the same time, a lot of patients that are, in a way, a lot of support is necessary for the patients to receive a transplant at some point to be cared after the transplant. So we have intervention for the donor and also intervention for the recipient. So there is a very, very close link between organ donation and the entire program itself and critical care. So yes, absolutely.